I'm just wondering, how long is NARD willing to hold that for? Because several groups going on strike now. You have NARD, you have ASU, you have NASU. What if it turns out that it's going to be perhaps longer than everyone, including NARD, expected?
We hope it doesn't get to that, by the steps, so far taken. We hope it doesn't get to that. We want to, like we said, allow today. With the mandate they said they have given, let us see how it goes for today. If they pay, I can tell you, we'll call out the strike.
Are you being totally truthful when you say, or fair when you say that we allow today? Because now we're reading, I don't know where this communique has come from. We're seeing here that indeed there were shortfalls in the salary, but that it was for those who were not on the IPPS platform, those who were not paid directly by the federal government, who were on their, is it hospitals, some payroll of some sort. And now we hear that they're currently dealing with paramilitary staff, and as soon as they're done with that, they will start regularization of doctors, resident doctors specifically, on the IPPS platform from October. From the look of things, do you think that this strike might hold on till October before it is called off?
No, let me clear you on that. The IPPS enrollment, we want to get into IPPIS, and they have said by October they will enroll us. We are fine with that. The issue of shortfall did not start, it started, January. And then February, March, as it goes. So we're saying pay us. We're not even in that meeting we agreed, okay, this August shortfall. September, there is the likelihood there's going to be shortfall. We gave that room. So by October, everything will be corrected. But that's not the issue. We're talking about, shortfalls of January, February, March, which they have. The issue of IPPI is a different ballgame altogether. We have said, we have written, enroll us. If you're claiming that it's IPPI that is making us not to get our full salaries.
Yeah, but when you say if you're claiming, you also observe that IPPS shows, that those who are on the platform get their full salaries.
Why? Is the same federal government? Is it different?
But is that not the truth situation?
Those in IPPS, they get full salaries. Why are we not getting? It's the same federal government. That's what I'm telling you. You should be worried about that.
Of course we're worried about it, but we're saying, isn't that the reality?
That is what I'm saying. You are paying some people full salary because you put us on a non-regular allowance salary. By the way, that's not what it's supposed to be. You are not paying us full. It's not our responsibility. We work, you pay us. You should pay us our full salary.
What if they say that there is some bureaucracy? For instance, now, I don't know what the problem is, but assuming there is some extra budgetary provision that needs to be made for that, will you be patient enough to let that go through?
You mean they didn't plan for it ab initio? For salaries?
Because we had a conversation with the Minister of Labour, and he was saying that what they found was that some hospitals had employed people behind the scenes, and their employment was yet to regularized, and so they were spreading salaries to ensure that even those who were regularized and those who were behind the scenes, had to go home with something, and that right now they have to take those people who have been employed behind the scenes on the payroll, and that might also involve some extra budgetary allocation.
Yeah, well, the scenario you're painting is that when they employ, they didn't recourse to their principals. So, it's not that. We are there.
Are you aware of situations like that?
Well, they could claim that. I don't know. I don't know about that. They could claim that. I don't know.
They could claim that.
We are not chief medical directors. Our own is that we've been in the employ of government. You should pay us.
Are you not aware? are you not concerned about how your members sometimes get in?
It's through due process. I don't know about any backdoor. It's through due process. Anybody who employs doctors without recourse to due process, it's left for the government to sort that out. It's not us. We got in there through due process. So they all know that. So this one they are saying, I'm not aware that some people through the back door bring in doctors. I don't know about that. It's strange.
Okay. The question was, if assuming they say that, the budgetary provisions don't look like they're sufficient, we might need to make extra allowances, would you be patient enough to let the
government has the
go
capacity.
Through?
Government has the capacity to sort it out. I can tell you.
How do you know that?
No, government has the capacity.
From where?
They know. They have the capacity. They know they have the capacity to sort it out. You don't just plan budget and you don't make room for exigencies. You know, so government has the capacity.
Is this an exigence? Considering the fact that this
No, I'm just saying you're talking about something.
Some recurrent expenditure.
No, that's the point I'm making is they should have budgeted that being issue. And they did. So what you're saying, like I said, is strange. So if it's a strange occurrence, they should start it out. I don't know. I know that people are taking and then everybody knows you're taking, you do interviews, you come in. So they have that. So you can't be telling us that you have not made adequate budgetary provision for payment of doctors. That's not our responsibility. We are there to work and get our salaries. Like every other person who gets it in IPS. They don't crack their heads. They don't sweat about it. Now you have turned doctors to looking after what amount of money have you paid me and all that. It's unfair. It's unfair. You should know that. It's unfair.
Well, we have to thank you most kindly, Dr. Chinaka Ugochukwu, and we do hope that this impasse will be settled and resolved as soon as possible, and the doctors will be able to go back to work as soon as possible so they can get to serve patients. Thank you so much for coming on Sunrise Early.
Thank you.